So the treatment options for all of musculoskeletal surgery are non-operative and operative. Non-operative treatment is weight loss, anti-inflammatories, activity modification. In other words, if it hurts, don't do it. Some simple adjustments and time might settle a lot of things down. Sometimes it's useful to have an injection to know for you in your own mind that it's coming from the hip, especially if you have that complex overlay of symptoms. So it's not uncommon to get an injection, for me to arrange an injection for you so that you can be sure in your own mind, and I can be sure that it actually is coming from the hip. And then there are two options available typically for hip joint pain. We're not talking about lateral hip pain, but joint pain. The first is arthroscopic surgery, and there's some very clear indications for that. If you have labral pathology, if you're young, if your joint is well preserved, then definitely that might be worth considering. Quick recovery, generally very successful in about 85% of cases. The other one which all orthopaedic surgeons love talking about is hip replacement surgery, because it's the most effective replacement we do. There are good joint replacements and bad joint replacements. Some joints take longer to recover than others, and hip replacement is the gold standard replacement. So all other joint replacements are measured compared to hip replacements, put it that way. It's not uncommon for people to feel that their pain is gone the next day. You feel like your life has turned around pretty quickly. And it's obviously a complex operation with lots of potential complications, but generally, if you were to have an operation and you could pick one, it would be a hip replacement. With replacement surgery, recovery is crutches for a few weeks and driving when you feel comfortable, when you're sleeping okay, and when you're off opiate medication. With arthroscopic hip surgery, it tends to be quicker than that. The only thing you can't do after hip replacement is jog, or I wouldn't recommend it anyway. There are some large bearing hip replacements that claim that you can return to contact sport with them, but really I think you're taking a big risk. So jogging and contact sport generally, and jumping off large objects, generally not recommended with a prosthetic joint of any kind, but specifically with hip replacements.